Craig Spencer. That's the Doctor Without Borders physician who presented with Ebola symptoms earlier this week in New York City, and yesterday was confirmed, or Thursday was confirmed to have had it. He was a traveler from West Africa. You know, one of those that we don't have to quarantine. Remember what the CNN said about that? About the CDC, rather? The CNN posted a timeline on what Spencer did after he got back to the United States, but before he was diagnosed. He was in contact with a few people. After he started exhibiting symptoms, authorities said, Ebola is not contagious until someone has symptoms, they say. 3 people, his fiancée and 2 friends, are now in quarantine and are being monitored. They are well at this time. Now, these authorities provided a more detailed timeline of where Spencer has been since Tuesday, which is when he started feeling fatigued. On Tuesday, he visited a coffee stand at the High Line, a park built on a former elevated rail line on Manhattan's west side, and a meatball shop restaurant in Manhattan. On Wednesday, he took a 3-mile ride along along Riverside Drive and in his neighborhood. And then he took the subway to visit the Gutter Bowling Alley in Brooklyn. He wasn't symptomatic until Thursday. The bowling alley closed Thursday as a precaution. Okay, fine. Now, I'm missing something, though. Dr. Spencer flew here from West Africa. We're told that we don't need travel restrictions because, among other things, we screen those travelers really well. Remember, they keep telling us that? We ask questions like, have they been exposed to Ebola and all? Dr. Spencer's answer to that question would have been, well, yeah, it's my job. I treat Ebola patients. Was he under any kind of close scrutiny? No, we just heard he's been out and about, running around, going to the park, having some coffee, getting a Subway sandwich, taking the subway, bowling, that kind of thing. It's called living your life, which people tend to do after getting off of airplanes. A couple of weeks ago, I had Dr. Tom Combs on the air. He's an author and a former emergency room physician with 20 years experience in a level 1 trauma center. Now he's also a novelist. Dr. Combs has been very critical of the way the CDC has been handling things. And in light of the most recent events, I thought it might be useful to have him back on. And he joins us now. Dr. Combs, how are you?
I'm doing pretty well, Forrest, and I am glad, as you are, at noting Nurse Fam's recovery. That is tremendous news.
Yes, it certainly is. And she was standing there just looking great, looking healthy, strong voice. It's great to see. Now, so let me ask you this. Now, how do you feel after all this happened and all the CDC has said and things it was saying before we last talked, and you were critical of them last time, things it has said since, how do you feel about the current protocols as they now stand for international and domestic flights and the overall strategy for containing this epidemic?
Well, I think first I want to characterize what I said before, which was that I felt that was a failure of management by the CDC, but also prominently the World Health Organization and the United Nations.
Right, yeah.
Admittedly, this is a very difficult circumstance, but the message I shared with you then and the observation I had and shared by many is that for over 2.5 months it's been quite evident that quarantine was not being effectively utilized. And that, I feel, is the greatest deficit and the single most effective thing we can do, and we are not doing it. And you talk about where are we at in the current position. We're still at a point that is suboptimal. We are counting on screens that we recognize are not effective screens.
Correct.
The presence or absence of a fever does not rule in or rule out the presence of Ebola infection.
As we just saw with this couple of people. That's exactly, including this doctor most recently.
Exactly, and that is the situation that I think presents our opportunity, and I've been hoping that maybe I can, in my small way, help move us towards what I think is the best position we can take that provides the greatest potential for safeguard, because the screens that we have in place now, as has been demonstrated, are not effective. And repeating the same screen on the United States in United States airports, while I support virtually every step we can take to safeguard and prevent the spread of Ebola, not just in the U.S. but anywhere else. But again, the application of the identical screening process really is not likely to yield much of any improvement in safeguard or capture of those asymptomatic patients that present the greatest threat.
Right, sure, because you ask them questions on one end, and they just repeat the same answers on the other end, and if they were lies on the front end, they're lies on the back end as well. Plus, they may not even know if they've been exposed to Ebola. They may not even have that knowledge in their mind, so they don't even have to lie to slip through. So, all right, well, now, what do you think about, since last, because we, between the time we scheduled this interview and now, New York City has put those new restrictions in place, and it plans to adopt a very serious 21-day, you will stay in this government-run closet or whatever quarantine. What do you think about that?
Well, as I said, I support every step, essentially, that safeguards and diminishes the likelihood of spread of Ebola. The consequences are so incredibly profound. And I think that's one thing that, in a sense, there's been a lot of communication where there's reassurance provided, but at another level, it's healthy to be scared, active about the possibility of the spread of Ebola. And again, this is not just the United States spread. We're talking about the possibility of spread to any other nation wherein we have failed quarantine and have established new life for this epidemic and established another site that would have to be eradicated, wherein the disease would have to be eradicated to avoid just tremendous, disastrous costs and human suffering.
Right, and we just saw it arrive in yet another nation this week. It arrived in Mali by way of a traveler, and that person I just read did die. So now they've got to do the whole thing about, figuring out how many people were contacted and all of that in a brand new nation. Dr. Combs, can you hang on for about another 2.5 minutes? I need to take some commercial break here, and I'd like to talk more about this same subject if you can stay with us. Forrest Carr Show, the Bashful Bloviator on Power Talk 1210. We're going to continue our conversation with Dr. Tom Combs, who is an expert ER physician and a level 1 trauma surgeon and all those kinds of fun things. And we're talking about Ebola. And Dr. Combs, we were talking before the break. You made a statement that I find intriguing about how it's good right now to be a little frightened. Now, I watched the other day, CNN, a network that I actually like and admire. But they were running what we in the business call wall-to-wall live coverage, and they're showing a single plane sitting on the tarmac holding a single patient. That was Nurse Nina Pham, actually. And they went on and on and on and on and on about it for quite some time while we're sitting there watching the plane. And they're showing video of the plane just kind of taxiing and then parking, and now we're all waiting for the nurse to be wheeled out, and they're going on and on and on. This same network the next day ran an opinion piece on its website telling people like me that we should calm down and shut the hell up and quit overreacting to Ebola. So, what do you think? Is the American public, are the American media overreacting to Ebola right now?
Well, I hate to characterize in a single statement, but I think that historically there appears to have been a very significant concern about the public panicking or overreacting, and it seemed like the messages that came out, and this wasn't just from the media, it was from World Health Organization officials and others that were, I think, errantly reassuring. Actually has been demonstrated as errantly reassuring. And now as things have progressed, and tied to that position and posture was the fact that we haven't taken this aggressive a quarantine step that, or even acknowledged that it is ultimately desirable to do so.
Right.
So we've been kind of off target a little bit by the, like you say, a certain reassurance that's being provided. Whereas I would favor the focus that we need to recognize how absolutely significant, damaging, and the potential for suffering the spread of this disease could entail. and we need to do the most effective things we can do to stop it. This is a biologic war. And it is known that the most effective thing we can do is quarantine, containment, isolation. And I am perplexed that is not the stark focus of the international effort. And I know it's difficult, and there's logistical challenges and costs, and we have a number of countries involved. But there is no enemy here other than the disease. And I am just hopeful that we are able to come together with a aggressive, medically sound plan that is supported internationally with the needed resources, personnel, and commitment to make this a significant step. Now, short of that, the other attention of, for instance, the plane you're talking about on the tarmac, that's human, and it is
sure.
news, and it's captivating. It's captivating news, and frankly, I think a lot of people, particularly in the United States, don't know what to think right now. I don't know what you found, but I find some individuals who will kind of dismiss it and say, no, this is not going to be anything. And I certainly do not hold that position. I fear the potential. And, as in my career as an emergency medicine physician, we identify people, and one of the first thing we always do is try and rule out what is the most significant risk or threat to this patient, and what must we do to establish whether it's in fact present, and if so, what can we do to offset it. And I think that same approach is what needs to be done internationally as we identify this very clear and marked threat, the Ebola epidemic, and work together in the most effective way possible to contain it, to provide the West African countries the support, humanitarian and treatment support that they need, but also a lockdown approach to do everything possible to prevent the spread of this epidemic, because that is the worst possible outcome.
I think that I agree with everything you're saying, and one of the things that I say, because I've been hammering on this subject for ever since the outbreak arrived here, because they keep actually before that, because we kept hearing from health authorities that they have protocols in place to keep it from spreading, and yet healthcare workers continually get sick. And I raised my hand and said, this is not adding up. Because either you don't have the proper protocols or you don't have the proper training. One of the two, something's not working. And then we had 2 nurses get sick here in the United States, and suddenly they decide, okay, we need new protocols. So my point being is that when people pay attention to what's going on and they get concerned and they pound their fist on the table, they do get action. The CDC did alter its protocols. This is a good and healthy thing. This is not overreaction. This is being appropriately concerned. Now, toward the, I want to come back to something you said on the program last time, which turned out to be, I think, prophetic. Because we were talking about the CDC, and its position at that time is that any old hospital can treat Ebola. And you were saying very loudly and very clear, no way. You need to have specialized hospitals. You need to have places that are set up as centers for excellence and centers for expertise, and that is not just any old hospital. And not long after you said that, we saw those 2 patients, both of them were sent to specialized facilities. Where do you think the government and the medical establishment stand in its thinking now? And how do you see that philosophy progressing if, God forbid, we get more patients than those 4 specialized facilities that they're talking about now could actually even handle?
Well, I think there has been a move towards regionalization, and I think that is a good move, as you mentioned. In my career, the origination of trauma hospital designation arose in the course of my career, where the significant expertise, resources, and experience that is needed to care for trauma patients results in lives saved and improved outcomes. And I think the same rationale applies to this new and significant threat. And you mentioned training and protocols, and you can have good training and you can have good protocols, but this is also a human endeavor. Myself, as a medical student, well aware of what precautions I was attempting to take, I suffered an inadvertent needle stick when taking care of an IV drug-abusing patient.
Right, you mentioned that last time. That's got to be scary, man.
Yeah,
I can't even imagine.
So again, there was a good protocol. There was a good. My attempts were definitely well directed. My training was good, but in the middle of the night, on taking care of multiple patients, a single human inadvertent slip occurred, and those kinds of things can happen. But the getting back to the regional or specialized care, the other big plus from that is that there is an ability to focus clinically on those patients with regards to how are they responding, what kind of research information might we be able to gain to help us treat things better in the future, what type of laboratory assessments might be done more efficiently and more effectively. And that's actually one of the things that I think that is laboratory utilization has at least the possibility to help us streamline the 21-day quarantine, which I feel is essential for anyone attempting to leave one of the afflicted countries. We may find, with research and the development of more sophisticated testing, that we're able to identify at day, X, day 12, that, if the test is negative, they're going to stay negative. Now, again, that's the kind of information that requires a lot of experience, and that could develop both here, but also this relates back to our international focus, where the international community can attempt to advance these things in the disease-ravaged country, where unfortunately there is a significant amount of patients with which to gain information.
All right, Dr. Combs, listen, you've been a great guest, and you've given us a lot of great information, and a lot of your comments a couple of weeks ago turned out to be so prophetic, and let's hope that our government wakes up to some of these things you're telling us. It seems like they've woken up to some of them, so and now we just need to see if they're going to get with the program. But Dr. Combs, thank you so much. And I know it's 2 hours later where you are in the Twin Cities, so I really appreciate you staying up late for us and being on the program.
And Forrest, I appreciate it. And one last thing, if I could please say,
we got about 45 seconds.
If it becomes apolitical and we focus on the job, this is biology, and we need to fight the enemy, which is the disease. Absolutely,
Dr. Combs, thank you so much. And you know what? We may call on you again as this disease and the fight against it progresses, because you're turning out to be a great expert for us. So thank you so much, and please enjoy the rest of your Friday evening.
I'm hopeful that it's productive, and that's what I'm trying to do, because we're all in this together. And
absolutely.
Let's make it work.
All right. Thank you so much.